Good morning, everyone. I'm Shelley Evans, and I'm pleased to welcome you to this presentation, Prioritizing Wellness, Self-Care Strategies for Mental and Physical Health with Dr. Charles Holmes. This conference is sponsored by College of Arts and Sciences and facilitated by the University of Arizona Global Campus Department of Behavioral Sciences. We hope you enjoy this session, and I'd like to ask everyone to mute your mic during this session. And please welcome me in joining Dr. Holmes in the chat. Thank you.
Thank you very much. Let's see if we can share my screen. Okay, everything look good on your side, Shelley?
Yes, thank you.
Okay, perfect. Well, thank you all for taking the time to spend with me today. My name is Professor Charles Holmes. I am the chair of the Master of Public Health program here at the University of Arizona Global Campus. This is a brief overview of what we'll be discussing in today's presentation on how best to prioritize your wellness. And we'll start with what is self-care. Now, I know that you've been in probably a lot of sessions. I know I have on wellness. So some of this may just be review, and that's never a bad thing. Self-care is essentially an individual taking a deliberate action or effort towards maintaining or improving their health and wellness. It covers the full scope of a person's life, from physical to mental, social, and spiritual. Anything that can impact you as a person would qualify. And fortunately, the effort required for each varies depending upon the desired outcome. If you're looking for, small changes, then it's a small amount of effort. If you're looking for large changes, then obviously greater effort is required. The most common areas people tend to focus on are physical, emotional, mental, social, and spiritual. So why does self-care matter to you? The United States has the lowest life expectancy for all high-income or developed countries in the world. In this graph, you can see longevity started to decline for us in 1992, with a significant divergence taking place during the beginning of the COVID-19 pandemic in the early 2020, and continues to decline even today. Kind of adding insult to that decrease in life expectancy is the fact that the United States spends more on healthcare per person than any other nation. The question then becomes why? Primarily, it comes down to a lack of prevention or public health infrastructure. The most recent data available shows that in 2021, the United States spent $12,914 per person on healthcare. Now, I know I didn't spend that much on me personally, but you can imagine that there's individuals that require substantially more, and that comes out to be the average, and it's an immense amount of money. From that $12,914, $55 was spent on prevention. So $4 for prevention for every $1,000 going towards treatment or curing you. And I'll let you guess which path generates the most amount of money for the healthcare industry. They're much more inclined to help you when you get sick than to set up an infrastructure or put things in place to keep you from getting sick in the first place. So that's really what our talk focuses on today. How can we best take care of ourselves and maximize our quality years of life? Being a free market economy, the healthcare industry and the government insurance companies, they're not going to do what is really best for you in terms of making sure that you have the best life possible. So to maximize our quality years, we first need to look at the pervasive issues. These graphs show that in general, Americans as a whole are unhappy, and without some measure of happiness or satisfaction in life, our minds and bodies suffer. What was also highlighted but not included in this graph is that Americans earn the highest wage on average of the developed nations, and we also purchase the most consumer goods. So we're making the most money, we're buying the most stuff, yet we're still unhappy. And that serves in contrast to the World Happiness Report that was released last week. Once again, the Nordic Scandinavian nations like Finland, Denmark, Iceland, Sweden, and the Netherlands remain in the top 5. The United States was ranked 24th this year, and it's the lowest level that we've been in since the reporting began. So what is setting us apart from these nations that are consistently rating their quality of life among the best? It's certainly not the climate. I don't know if any of you have been fortunate enough to travel these areas. In the summer, they're lovely. But spring, fall, winter, it's just a mixed bag of just terrible weather. So it's not the climate that's making them happy. The greatest driver is that the economic inequality in these nations is among the lowest, with the belief that a rising tide should lift all boats. This means that more money generated by companies and or the nation is fed back to people via higher wages or lower prices on local goods, as well as larger social support systems. This is social self-care in action. This is really what social self-care is. The nations rated among the happiest have a stronger belief in the kindness of those around them and a more regular engagement with the community. This fits with many social science findings that community engagement helps everyone live longer and healthier lives. And unfortunately, the US has seen a tremendous decline in memberships and social groups since the early 2000s. And it really actually started even back in the 80s and 90s. But the greatest decline was in the 2000s. The pandemic was a huge drop. Obviously, we all had to social distance and we never recovered from it. So either people are still social distancing or they just lost interest in connecting with people face to face. But I think one of the most interesting elements of the report that was sent out was the lost wallet question in their survey. And the countries listed in the top 10, they had a very strong belief that if they lost their wallet or purse, someone would return it. And in the United States, that belief is at an all-time low. So if you could put in the chat, what do you believe would happen if you lost your wallet or purse? Would someone give it back? And then also consider, is your answer dependent upon the neighborhood or is it location dependent? In these top 10 countries, it's not. They just have a general belief that their countrymen will support them. So this unhappiness in the United States results in a lower quality of life and ultimately what it amounts to a shorter life for us. So what is driving these, kind of emotions for us? First and foremost, outrage is absolutely exhausting. And that was going to be the original title of this. Outrage it's awful. All forms of marketing rely upon ratings, which spurs advertising to spend more. In order to garner viewers and ratings, they strive to provide eye-catching headlines, and advertising research has shown that fear is humans' easiest motivator. So marketing algorithms in our phones and computers are able to determine what we fear, and those are the stories that'll, usually end up on our front page. The genuine intent of most of these organizations is to make you feel like you're not whole without their product. So you must buy or use their product to feel safe and happy. And that's in contrast to, those top 5 nations we spoke of earlier. So during an election year, regardless of your politics, this gets turned up to 11. I mean, it becomes crazy. The idea that every decision we make could be the most important of our lives was coming across every media source. Using that kind of language paired with the constant updates, this may happen, that may happen, leads to an increase in stress, which releases a chemical in our body called cortisol. For those of you not familiar, cortisol is essential to ensure our fight or flight response systems are ready in times of high stress. The downside is that if we're constantly stressed or outraged, cortisol and other stress hormones have a very negative impact on our body's physiological processes. It impacts our blood sugar, making it more challenging to regulate. Our immune system is less efficient. Bone density decreases, so we can actually, develop osteoporosis. Muscle tissue repairs slower. Heart rate and blood pressure go up. It's literally exhausting your body and mind to be stressed all the time. So countless studies have shown that by making a conscious effort towards self-care and positivity, your stress levels will decrease, your productivity and focus will increase, and your general emotional regulation and personal relationships will improve. And that all sounds wonderful to me. So that's why I looked into this topic. So then we need to ask ourselves, what's the best way to make real time for myself? In an informal survey of fellow faculty, I discovered that the majority felt that if they were in their office but not working on work, it was free time. Your mind and body do not agree. It takes our minds approximately 66 days to create a habit or a behavior for a space. And I would venture to guess that most everyone in attendance today has been in their workspace for more than 66 days. This means that once you enter your office or sit down at your computer, your mind is going into something like a work mode. Whether that means additional focus or heightened ability to multitask or problem solve, something is happening in that space. You've heard this probably more in relation to a bedroom where you want it to be a quiet space and you only use it for sleeping, things like that. Same idea applies to your office. So whether that means additional focus or heightened ability, your body and mind are reacting to the space to engage in their usual activity. To make real time for yourself, you must leave your office and get away from your work. And this is absolutely not easy. I fully acknowledge that, but it is very much necessary to allow your body and mind to enter a different state. For example, I have a TV within view of my office desk. I can see it now, it's turned off, but my belief was that if I found myself with some downtime, sitting in my office chair and watching a ball game or a soccer match, it was going to be a mental break for me. My body did not agree. While it was not active work, by remaining in my office, my body and mind were not able to fully shift into a non-work mode of sorts. Because at any moment I could get a new email, an alert could pop up on my screen, and I would need to jump back into it. And if you're working, 8 to 10 hour a day, 5 to 6 days a week, the time in total will absolutely add up if your personal time is being spent in your office. So we have to be able to break away. So what is the best way to take those mental breaks? My father's favorite quote growing up was that the only things in life we can control are effort, attitude, and decision making. And while it is always not always easy to choose to be positive, especially for me, I'm more of a curmudgeon kind of devil's advocate person. The physical and mental health benefits are astounding. The evidence is overwhelming that I have to change my perspective to be more positive. Mental breaks can be something as easy as getting up from your desk and going to a different space of your house to engage in something different. Ideally, a mental break will involve you fully leaving the space where you work and being able to go outside. I think it was mentioned in the previous presentation, which I fully agree with. Anytime you can engage with nature, that's always a huge positive. I am fortunate enough to live in an area that's surrounded by nature, but unfortunately, I don't get to engage with it too often unless I'm taking my dog for a walk. So one of my little tricks is that, if I run out of water, instead of filling up with the faucet downstairs where my office is, I can climb the stairs, go to the kitchen, look out the window. Going to add maybe 2 minutes to my round trip, but it at least helps me to break away and do something. So these perceived breaks, though, are the trap that I fell into. The idea that I can do these small things and it's going to be enough. Pausing to look out the window every few hours to readjust my eyes. That's great for fatigue, but it's not going to allow your mind and body to reset. Picking up a book of interest. I have a great collection of personal hobby books behind me, and maybe I'll read for 10 to 15 minutes while I'm at my office desk. Again, not a mental break. It just doesn't work that way, unfortunately. And I felt the consequences. So we need to get up. We need to fully disconnect our minds from the workspace. The recommendation is every 2 to 3 hours, try and take 10 minutes just to get up and move away from the space, get away. If you're able to do that, then you will feel benefits. These practices paired with mindfulness exercises that are recommended by Keynote and author Matt Tinney, I think his presentation's coming up in a bit, can reduce levels of anxiety and depression while boosting your immune system and your mental health. So knowing that we need to step away from our offices, next we'll have a quick discussion on preventative vaccines. I am in public health after all. So vaccines remain our most potent method to prevent severe illness. While this presentation is not intended to dispel every myth that surrounds vaccines, and I'm not here to convert anyone, I can say unequivocally as a public health professional of 20 years and someone who's married to a physician and surrounded by friends who are physicians and scientists, vaccines absolutely save lives and they do not cause developmental issues. I believe many run into trouble when they hear anecdotes or singular stories of side effects or reactions and assume that that's going to apply to them. Very, very rarely is that the case. Additionally, many have been led to believe that all vaccines prevent illnesses in all cases. So when they get sick, they become distrusting. This one makes the most sense to me. I've gotten the COVID shot. I waited a few weeks and then I got COVID, or I got the flu shot and then a few months later I got flu. That makes sense why it would be, confusing. While there are some fully protective vaccines like MMR, measles, mumps, rubella, polio, hepatitis B, most are preventative vaccines like influenza, COVID, shingles vaccine, Shingrix. The goal of these preventative vaccines is to limit the amount of time it takes for your body to react if your immune system should encounter the virus. In the case of influenza, you're 40 to 70% less likely to need hospitalization if you have the preventative vaccine. With COVID, the level of protection increases even more. Without the preventative COVID vaccine and those boosters, you're 3 to 10 times more likely to require hospitalization. So while you still may get sick, you may still have, you may still get the flu, you may still contract COVID, the severity will be greatly reduced and it will allow you to return to a healthy state faster. And that's what we want. We want to, return you to 100%. I'm fighting a sinus infection my daughter brought home last week, and it's been as annoying as can be. So we all know when we don't feel just right, and the goal of these preventative vaccines is to help you get back to that 100% as soon as possible. So we know we need to step away. We know we need to obtain these preventative vaccines to avoid severe illness. So now we can focus on what is going to give us the greatest boost each and every day. That's a good sleep routine, exercise, and dietary balance. Multiple studies have shown that an adult requires on average about 7 hours of sleep a night, 30 minutes of activity each day, and a balanced diet with the aim of maintaining caloric balance. Setting up a sleep routine can be a great way to start, and many smartphones, watches have apps that can assist you in developing this habit. My wife showed me a few weeks ago that Netflix even has a channel on mindfulness and helping you to calm down before you go to sleep. So if you're someone that likes to fall asleep with the TV, that might be a great option for you as well. And it leads you through kind of those meditative exercises on ways to calm down. Exercise is also very important, and similar to the vaccines, I think the intensity is where the exercise idea gets a little more confusing. You do not need to exercise 30 minutes a day to exhaustion, flop sweat, all that stuff. That's not the intent. Even something as simple as walking for 30 minutes each day will have dramatic health benefits. Being in Colorado, I know that walking my dog a mile and a half takes about 30 minutes. Adding in the winter and snow factor, which is unfortunately coming this weekend, and I know my body's going to engage more. I'm also at altitude, about 6,000 feet, so that also burns more calories. Those are all things that kind of work to my benefit. And when the summer comes, for all of us, that's going to work as well. For those of you in Arizona, it's going to work even more so. The idea, though, is to start small and work your way up. Very, very few people are able to go from nothing to 30 minutes a day without really negative consequences on their body. And remember that we have to set those trends. So something as small as walking to the end of your driveway to get your mail, make it, walking back and forth twice, or walk to a neighbor's driveway and back home. Walk to the end of the street. Whatever you feel comfortable doing on that first day, and then each day just try and improve it just a little bit more. And the idea being that once you get to 30 minutes, if you can go a little bit beyond 30 minutes, the health benefits are just going to continue to add up. So those are all the positive things that can come from it. Diet is often the greatest challenge for American adults. Unfortunately, the food that tastes the best provides us the most comfort is often the worst for us. It contains a lot of butter, salt, sugar, things our body just doesn't really like and impacts our physiology. So if you're among the 80% of Americans that are looking to lose weight, the goal is to create what's called a caloric deficit. For example, if you take in or eat 2,500 calories, 2,500, and you burn 3,000, you're at a 500 calorie deficit, then you are going to lose weight. It will take time, but that's how the process works. There is no quick fix. Short of semaglutide medications, weight loss takes time. And even if you're on the semaglutide medications, you still have to exercise and eat healthier. You're going to have a yo-yo effect. And I've seen a lot of individuals, especially here in Colorado, that have used them and had really negative consequences because they've changed nothing in their life other than taking the semaglutide. It does reduce your appetite. It does make you nauseous. But as soon as you get off of it, all that stuff comes, all the inner urges and everything else come back, and you can have, again, yo-yos. And that's not what we want for long-term success. So everyone knows that eating a balanced diet of fruits and vegetables is ideal. If we could do that, obviously we all would. But even small steps like choosing a lower calorie option at your favorite restaurant or fast food space can have really positive impacts. So choosing the medium meal instead of large, not getting fries, those little things. There was a great set of books. I think they're discontinued now. It's called Eat This, Not That. And it would provide all the chain restaurants in the United States, and it told you their worst food and their best food. And it was just fantastic. So hopefully someday that'll come back. Consumer Reports does a little bit of that, but those are the things that you can look for, is how to make little modifications that you're going to stick with. My father's a great example for this again. His health is not great, and his weight is much higher than it should be. So for Lent last year, he gave up chocolate-covered peanuts. That's his favorite snack. He always had a container next to his recliner, and he's always had one in his truck. By removing just those two containers, he lost 10 pounds in 1 month. No other modifications. That gives you a sad idea of how many chocolate-covered peanuts that man was eating. But just on that alone, sometimes something as simple as removing that unhealthy snack from your routine can have really, really significant impacts. And finally, the easiest dietary adjustment, I think, for most people is just to consume more water. Drinking water. Soda and juice do not count, and some teas don't count. They're too highly caffeinated. But drinking water supports your physical and mental performance while improving mood regulation. And this stands to reason. 60% of our body is composed of water. So if we're taking in clean water and we're able to expel toxins and bad water, we're going to be better for it. So drinking more water is a very easy dietary adjustment. Last but certainly not least, use vacation days. Be strategic and selfish with your vacation days. By this, I mean, know what you plan to do on those days and carve out time for yourself where possible. Using myself as an example, I have two young children. I have a 3-year-old and a 6-year-old, and that means that my official vacation days almost always overlap with my kids. Federal holidays, designated seasonal breaks, travel activities, those are all kid-centric activities. And while spending time with them is great, it is not actual downtime. I can't think of the last time it was actually downtime. So in 2025, my hope is to utilize some of my vacation days to find days where my kids are going to be in school and I can take some real time to engage in hobbies that are meaningful for me. While it won't happen often, finding those days and allowing yourself to recenter is really, really important and will improve your health and your mental well-being. What I found is that too often faculty save these vacation days for years on end. I got a note from HR that we have some faculty that have over 300 vacation days or vacation hours, excuse me, saved up. You're never going to be able to use that. There are no positions I know of, at least at UAGC, that would allow someone to take off a full month at a time. So with that in mind, make special weekends longer. Make a 4-day weekend. If you're not feeling well, take a day. If you want a mental health break, take a day. Work with your supervisor, and I'm certain you will find that they are supportive in your health efforts. One area of note with these vacations is to be aware, though, of the impact that they can have on colleagues and projects. So that's where I'm saying be strategic. I heard several faculty speak up in different meetings that it is very challenging to take vacation breaks. As someone who's worked with UAGC and formerly Ashford since 2012, I can acknowledge this. It is a challenge. But we must also consider the barriers that are in our way. So think about this. If you're teaching an extra course, ask yourself before you accept that extra course, is it more important for me to take this extra course, or is it more important for my mind and body to be able to disconnect and step away? Because you will be able to dial down a lot if you're not in the classroom. Very, very few people have that many meetings every day that they can't take a full break like that. So be strategic and make time for yourself. To summarize what we've discussed, I would say that all positive efforts will yield positive results. You know yourself best what you're willing to do, and most importantly, what you're not willing to do. There is no perfect strategy for everyone. I wish there was. It would be a heck of a lot easier for everybody to be healthy and happy. But using myself as an example, there is no perfect strategy, and start small. Remember that meaningful change takes about 60 days. For me, I wake up at approximately 4 a.m. every day and I exercise at 4:30. I know this time does not work for many, but I am not a night owl. I'm a morning person. I'm asleep by 9 o'clock. Anything past 9:30 and I become very, very cranky. So I'm up very, very early. This time does not work for many. And what I see is it's almost always around New Year's resolutions, spring breaks, things like that. There's a huge surge of people at the gym.
Stephen Netarosik took off his glasses and helped clinch a blow.
Okay. But yeah, what I see is there's a huge surge of people on New Year's Eve around seasonal breaks, spring break, things like that. And everybody's waiting for the gym to open at 4:30. And after a week or two, they inevitably fall off. And this is because 4:30 a.m. is just not a reasonable time for them, or their desire to exercise is too low. And that's where I'm getting the idea. Start small. Find something that's not hugely invasive into your current schedule. Find something that you actually have an interest in doing. Find the motivating factor, the intrinsic factor of why you're exercising in the first place. If you're doing it just because I'm telling you to do it or you know it's good for you, that's probably not going to be enough. You have to have something that motivates you, whether it be a spouse, a partner, children, grandchildren, whatever it is. Have that drive be your source of inspiration to get up every day and do those things that you need to do. Whatever you choose to do, again, start small and know that that meaningful change is going to take 60 days to really take hold. It will be impactful, though, and it will make a difference. So to close off, I wish you and your families a lifetime of health and happiness. And if I can ever serve as a resource, please feel welcome to contact me. Thank you for your time and kind attention. I'm happy to answer any questions you all may have. For those of you who are visual learners or interested in learning more about the United States and its struggles to find health balance, a great website for macro information is Our World in Health Data. And one of my favorite books right now is called Join or Die, talking about that disconnect that we have from these social groups and the impacts it's having on us physically. Thank you very much.
Thank you. Are there any questions? Well, I would like to ask you, Dr. Holmes, based on your research, what do you think is the most impactful wellness effort that we could pick if we were just to pick one?
If you only had the capacity to pick one, I would say diet. It's kind of the garbage in, garbage out idea. You can get, if your body's getting the nutrients it needs, its desire to stay in balance, yeah, a good diet will help overcome a lot of other failures in terms of exercise, social mental connections, things like that. So I would say diet is probably the most impactful.
I also was curious because I noticed how the trends were declining in the US for the health rates in kind of in the beginning of your presentation. Why do you think nothing has been done to change that, or what efforts do you think would change that?
Good question. Sadly, I think the short answer is money. Like most things in the United States, there's a financial incentive to focus our efforts on treatment and recovery versus prevention. There's not a lot of money in making sure that people stay healthy. If you think about it, I mean, just realistically, if a doctor exists and there's no patients, they're not going to, have much money. So that's the incentive. There was an effort in the 1940s. It was going to be a kind of a Bill of Rights for just being a U.S. citizen that was going to give everyone universal health care and careers and things like that. But the president who proposed it unfortunately passed away before it could come up, and then the next administration took a different direction. But um, yeah, there have been small efforts. The public health core and public health infrastructure have increased. The CDC, the NIH, they're doing great things, but because it's in a political space, it does ebb and flow, and that can have an impact on everyone.
Okay, and I see another question in the chat, and I was thinking of this too, because my father-in-law lives in Canada where they have the universal health system. And the person asked, do you think our health is related to our medical system as most of the other countries have social medicine?
Without question, I think a significant amount of our health is related to our health system. If you think about Canada or the United Kingdom or the Scandinavian countries that are doing so well, they have universal health care, and their systems are designed to keep you from getting sick because they don't have the infrastructure in place to constantly treat and cure everyone. They don't want you to get sick in the first place. That's where they're investing their money. So their food is a little bit healthier. They have lots of exercise programs in every community. They have lots of parks for people to engage in, walking paths. They encourage biking, and they have lots of space for that. It's just a very, very different system. So yes, I would say our health system, unfortunately, is actually a big detriment to most Americans. That's where the goal of this presentation, I think a lot of the other wellness presentations, is to, take that empowerment ourselves and find the way that we can be healthy without assistance from, the government or a negative influence from our health system.
And one more question here is, do you think people in those countries are more motivated to be healthy?
I think it's a lifestyle, honestly. I came from Chicago, which Chicago, if any of you have been there, is not the healthiest city in America. We had a Saturday Night Live skit actually on how unhealthy we were. And moving out to Colorado, it really is just a lifestyle out here. Everyone around us exercises, bikes. There's healthier food options here. I miss the food in Chicago tremendously. It tastes a lot better, but the food here is it's different. So I absolutely believe, and then I've been fortunate enough to travel to 26 different countries, and the countries that have universal health care, they have systems in place where you just see your neighbor exercising. That's a community engagement, and you work with them. Or you have a free fitness center. I don't know of many people that have free access to fitness centers, but they're free. You just go. You're, a resident of the community. That's your community center, and you go and you exercise without cost. That happens for seniors, I think, with Medicare. They have like silver sneakers and some other programs, but it is a big part of the success of those other nations. And like you saying, I think it was a father-in-law in Canada. They encourage you just intrinsically to just try and live your best life. And people's best life is not spent sitting on a couch watching TV. It's meant being active, engaging with friends, family, and yeah, just being active.
Thank you. Are there any other questions from any of the participants?
Oh, I see Darla's questioned, or it wasn't really a question. I lost weight in Europe eating pastries and pasta every day. That's one of my favorite ones, where people will say that, that I went to Europe and I lost 10 pounds and all I ate was pasta. You walk so much in Europe compared to how we are in the US. And that's, again, going back to that idea of the 30 minutes a day of exercise. Count how many, if next time you're able to travel, if you have a pedometer or a watch that keeps track of it, look at how many steps you took while you were in Europe or traveling throughout the US versus how many you take when you're home. That's a big part of it. That's a huge part of it. You can eat, all the fun foods, so to speak, if you're exercising and pushing yourself. 15,000 steps a day, that would do it. Absolutely. So yeah, you could definitely eat pasta.
Like going to Disney World.
Exactly. Well, Disney World, yeah. Well, and you have the stress component though of Disney World where
That's true.
you never get to go on the rides and it's hot and you've got people all over the place.
Very good. Well, thank you so much for sharing all these insights. These are some excellent strategies, and I think we can all take away something that we can try right away. So thank you for that. That concludes the presentation on prioritizing wellness. Thank you all the viewers for joining us. On behalf of the Department of Behavioral Science and University of Arizona Global Campus, thank you and have a great rest of your day.
Thank you all.